Last month, surgeons in Pennsylvania threatened to walk off the job in protest of skyrocketing medical malpractice costs. The walkout was averted thanks to assurances from Governor-elect Ed Rendell that he'll address the problem. But already the medical liability crisis in Pennsylvania has forced many physicians to move their practices out of state. We'll continue our conversation with Dr. Jeffrey Ratner, a pulmonologist and chief of staff at Center Community Hospital. Thanks so much for being with us.
Thank you.
As we talked about earlier, some doctors in the state have stopped seeing new patients. Others have closed their doors or actually relocated their practices to other states. How serious is the situation in Pennsylvania? And at this point, what impact has it had on the quality of medical care available in Pennsylvania?
Well, it has reached a crisis proportions, as we talked earlier. Many counties, especially outside of Philadelphia, physicians have either retired early or have left the state, and to those states that had more favorable medical malpractice premiums and offered more effective premiums and had effective tort reform.
Now, overall, statewide, 68% of malpractice cases, the physician wins. In Philadelphia in the last few years, they win only 45% of the time. What's happening? What is so unique or unusual about Philadelphia?
Well, I think that's a complicated question because I don't have all the answers. I think there's a greater sense of entitlement. There are a lot of lawyers there. There are many lawyers who, prior to the recent tort reform on venue shopping, wanted to take their cases back there because of the more favorable climate. I think a number of the judges, perhaps, were ex-plaintiff lawyers. I don't have all the answers, but it is an anomaly. 90% of the verdicts in this state came out of Philadelphia last year. That's way disproportionate.
What does this mean in terms of rural areas? So we see that there are, in fact, physicians in Philadelphia are 2 times more likely to be sued than they are in other areas of the state.
Well, one of the issues is you say, well, why does that occur? We have 6 of the most prestigious medical schools and hospitals in the country. Why? A lot of it has to do with where do really sick people go. They go to established tertiary centers that have great reputations. But they also don't get the outcomes that less sick people get. For instance, someone who may have had bypass surgery once or even twice and now needs a redo or to look at the situation, they are at much higher risk, this patient, than anyone else. And they may go to a hospital with a great reputation for that, but not have the result, the desired result. And therefore, if the desired result is not there, are they more prone to being sued? I can assure you it's not because of the quality of care at those hospitals. They are some of the most prestigious hospitals in the country. And how it affects rural Pennsylvania? Well, these medical schools are graduating doctors and residents from their programs. They are not coming to rural Pennsylvania like they used to. They're leaving the state. It is well known within the different academies and subspecialties that don't come to Pennsylvania, where malpractice rates have skyrocketed over the last couple of years.
And you wonder what this may mean down the road. We already have a nursing shortage, and in part because today's generation of nurses is not recommending nursing as an attractive career choice. Is that also happening in terms of young people pursuing medicine as an attractive career?
Well, let's look at the last 6 years. I think this year it started to even out a bit, but prior to that, the prior 6 years, the number of applicants to medical schools across the country have dropped dramatically. I think young people are not finding medicine an attractive career path. I think there are a lot of issues for that, but I think that's one of them, and it's regrettable.
Now, it's interesting because as more and more physicians find getting insurance difficult, we said earlier in our earlier program that over the past 3 years, 9 insurance companies have actually quit issuing medical malpractice policies in the state. What recourse do those physicians have? I mean, who then might qualify for state insurance, and what does that mean?
Well, the Joint Underwriters Association, which is really the insurance of last resort that's state-sponsored, everyone has to be assured that they can get the JUA. And in fact, 2 of the 3 contracted groups in our hospital that at the last second got insurance through JUA are paying exorbitant rates. I mean, it's not even a rate that you can quote in the marketplace as being fair. And even though the governor has recommended a 15% decrease for those who have not been sued within the last 8 years, who pay into the JUA premium, it's still a drop in the bucket and a stopgap measure.
In fact, there was recent legislation. Pennsylvania's insurance commissioner last November approved a 15% discount on medical malpractice for physicians who have never had a malpractice claim made against them. Is this a drop in the bucket? Does it make much of a difference?
It makes a difference, but it's a temporizing maneuver. It doesn't address the basic underlying problem, tort reform. And until we do that, we're going to continue to see these Band-Aid solutions that do not address the problem.
I want to follow up on tort reform in just a minute, but medical liability insurance rates have been known to rise and fall with the economy. And in fact, an insurance company from Harrisburg says that what we're seeing right now is a weakened economy and the result is increased rates. Does this mean that physicians need to just lay back and pray for a quick economic recovery?
No, and that is a completely fallacious argument, and that's one of the arguments given by the Trial Lawyers Association and a recent editorial in our paper, which was refuted by two of our physicians. If that had been the case, it's just a downturn in the economy, then every state would be experiencing the same problem. That's not the case. And also other insurances, casualty, etc., they'd be in the same predicament. Also not the case. It may be that some of those premiums have gone up a bit to reflect the last 2.5 years downturned economy, but that doesn't explain 505% over the last 26 years. So that is an argument that is used, that is just the economy and hang tight. Absolutely inaccurate.
Is there an average rate that Pennsylvania physicians are paying, whether they're in one of the high-risk subspecialties or whether they're a family physician, in terms of what they're paying a year?
Well, I mean, it differs with every subspecialty. Obstetrics, we're looking at, in some instances, $100,000 to $150,000 paying towards premium annually. Neurosurgery, it's higher than that. Orthopedics, California, on the average, $36,000. Our state, $100,000. There's a dramatic difference. And the only thing that can explain that is the caps, for instance, in California, on non-economic awards, pain and suffering, etc., which their cap is $250,000.
What's been happening in Philadelphia? Because I read that in 1998, the awards made in Philadelphia were higher in Philadelphia than they were for the entire state of California.
Well, it's unbelievable.
Sky's the limit?
Well, $353 million 2 years ago were paid out in verdicts. That's 10% of the entire country's percentage for verdict payouts. They have 5% of we have 5% of the population of Pennsylvania. Philadelphia has even less. It's totally out of whack. It's disproportionate.
Now, Frank Clementi, he was with Public Citizen, which is a consumer watchdog group. He says they, meaning doctors, should stop pointing fingers and instead look in the mirror. To achieve lower insurance premiums, they should clean up their own profession by strongly disciplining the small percentage of doctors who cause the bulk of medical negligence. Do you agree with that argument?
Well, to an extent I agree, in that as chief of staff of the hospital, I can tell you our credentialing process is quite elaborate. We take very seriously when a physician applies to our hospital for privileges. We look into their backgrounds, we look into their suits, the National Data Bank reports. We look into everything that we can do so. And then in 2 years, they're re-credentialed. How has their performance been at the hospital? We take very seriously. If we think the performance isn't up to standards, then they're called in and we review. And if they need additional training or something, we make that recommendation. So we work very hard at that. We really do.
Now, I mentioned that 68% of lawsuits are ruled in the favor of the physician. But I'm wondering to what extent physicians want to avoid the court trial and all that goes with it, and what percentage of suits are settled out of court just to avoid all of that?
Well, I don't have the number, but it's high. And I can tell you, we have a tremendous staff at Senate Community Hospital. Everyone's board certified. I'm somewhat biased because I feel strongly about our staff, and I can tell you that when physicians undergo the process of being sued and go into a courtroom, it is extremely trying. And Do some settle out of court? I'm sure they do. Sometimes there's pressure from the insurance company to do so. Most will go to court if they feel they've been wronged, and this is not a case of malpractice. Many of the cases, it's in the nuances of the case that we really define whether malpractice or negligence has occurred. And that's why the medical societies and other physician groups feel strongly about a physician group, perhaps paid for and employed by the state, review all cases before they even get that much further. The governor has recommended a certificate of merit, basically picking 1 or 2 physicians out of a list who would review a case even before it goes any further to see if there's merit to that case. That's critical.
The Pennsylvania Medical Society refers to this as lawsuit abuse, and you're talking about how to filter out frivolous lawsuits.
Absolutely. I mean, you pay the number I just recently read, $25,000 per case of a frivolous suit that's thrown out. And that does not include lost wages for someone giving deposition or appearance in court. I think the number is much higher. Well, you can figure out that most of the cases that are thrown out, what that would mean cost-wise to the entire community.
What role do medical consumers play in all of this?
I think they play a big role because this is affecting all of us. Don't for a second think that this medical malpractice issue is not affecting health premiums, their jobs, what companies have to pay, the economy. And therefore we, the medical society and those of us at the hospital are trying to do a grassroots campaign to work with local businesses through the chamber and the state chamber, through our patients, to educate them on this problem. Because if the problem is not addressed, there will be an access problem to physicians. They will not be able to get their care. And that's a critical issue that affects all of us.
We have less than a minute remaining, but the tort reform you'd like to see happen will take time. And I'm wondering what you think is going to happen in the interim and how optimistic you are that we can solve this problem in Pennsylvania.
Well, as Senator Corman, who proposed the amendment that would allow the General Assembly to look at the restriction on caps, that takes 2 successive legislative bodies to vote on it, and then a referendum to the community is out there. We're looking at 2005 at the earliest. In the meantime, these stopgap measures that the governor and others are coming up with will hopefully tide us over. But I'm concerned about physicians staying in place and seeing their patients and not moving on.
And on that note, unfortunately, we're out of time. Thanks so much for being with us. We've been talking with Dr. Jeffrey Ratner, who is Chief of Staff at Center Community Hospital. For Take Note, I'm Patty Satalia.
A copy of the program you've just seen can be purchased through Penn State Media Sales at mediasales.psu.edu or by calling 800-770-2111.